This is Tamanaki, and today I'm going to be talking about lymphedema or swollen ankles. What this means is that you have thick, red, irritated, discolored skin. It's always swollen. So when you come home at the end of the day, your legs are swollen, they're achy. This could be lymphedema. I'm going to talk about how to take care of lymphedema, the treatments, what to do about it. Is there a cure? The causes, the symptoms, pretty much everything, and kind of the tricks of the trade. And we're starting right now. So the trick is lymphedema differs from venous stasis edema. So venous stasis is more of like a non-pitting swelling. That's kind of the general swelling that happens at the end of the day after a long workday. Your legs are swollen, they're achy, your feet, your ankles. A lot of these treatments will help that we're going to talk about, but the reality is lymphedema is worse. Lymphedema is your lymph vessels are actually destroyed, and not only does your skin swell, but protein accumulates in the gravity affected areas like your ankles, your feet, and your skin can start to turn hard and scaly. If you ever saw like the condition elephantiasis, this can be similar and related. This is particularly important because it's terrible for your health. It increases your risk of cellulitis, infection, poor quality skin, and this can get worse and worse and accumulate, stop you from exercising, stop you from moving. So it's really important to take care of this. What I usually see is not only do you have lymphedema, there's like the pure edema that's caused by like radiation, like cancer, like infections or parasitic infection. Most people don't have this except for like cancer survivors, but it's usually a combination of lymphedema and venous stasis that I see. Even though, you know, it could be both, it's kind of tricky to tell. But what lymphedema is when you start to get that thick, scaly, indurated quality, that redness, that brownish discoloration. Go see your podiatrist, go see your internal medicine doctor, because you need to be evaluated properly. That means a history and physical, x-rays, MRIs, scans, lab work. Because the reality is there's a lot of underlying diseases like kidney problems, lungs, heart, congestive heart failure. And these things are essential to get treated before, but lifestyle changes are huge. So weight loss, eating your vegetables, keeping healthy and exercising as much as possible. These are very, very important things to your overall health. This will help all types of swelling. I'm going to come at it from a podiatry standpoint because as a foot doctor, there's a ton of things that you can do without having to take medications and without having to do surgery. But there are medications. I'm going to let the internal medicine doctors take care of that. But blood pressure medications, can help, but they're a symptomatic treatment. What I do from my standpoint is surgery for lymphedema. Now, I haven't really seen practical results like replacing lymph nodes or trying to repair the lymph vessels because once that damage is done, it's almost like scar tissue that can be permanent to a degree. But what I do is that thick, dry, scaly skin where we put lotions, medications, zinc oxide wraps to kind of exfoliate that thickened, dry, but this requires almost weekly wraps. You can combine this with home care. You can combine this with getting taken care of. Another way to get rid of that thick, dry, scaly skin initially is Epsom salt soaks. I love foot baths with Epsom salt. You can put your feet into a big bin with Epsom salt, 15-20 minutes of lukewarm water. A lot of that dry, scaly crust will come down. A lot of that swelling will kind of help flow through your body. Another way to get rid of that thick, dry, scaly skin is Una wraps. So we do that in our office. So basically a wrap that goes up your toes, up your ankles, and up your legs, and it's coated with zinc oxide. Over a couple days, that zinc oxide kind of squishes into that dry, scaly skin, softens it up, and it comes off without cutting or ripping the skin. For true lymphedema, we can write a prescription for sequential compression wraps. These can be really expensive if insurance doesn't cover them, but while you're sitting watching TV, these can squeeze your legs for an hour or two, and that really pushes the fluid back out and you urinate it out. Compression dressings, I personally in the office for cuts, bruises, use an edema wrap to compress that and get that dry skin down. But what works well is compression stockings as well. Now, insurance kind of covers these, but they have to be very high strength. And I notice patients don't really wear the higher strength ones. I recommend get some regular like 10 millimeter of mercury compression socks online. They're pretty cheap, like the knee-high socks, especially if you're walking or standing or sitting all day. These can make a big difference. They're a little bit easier to get on. If you feel that those are helping, then maybe ask your podiatrist for a higher compression strength. Physical therapy. Physical therapy can work really well. There's a lot of lymphedema clinics, and it's basically exercises and wraps that they do, but this requires regular visits. I also write a lot of prescriptions for home care for this type of thing to take care of people and get them feeling better at home. So that's a strong option if you visit your podiatrist. Exercises can work really well. So exercise, stretch, get your muscle strength up. Make sure your heart's healthy enough with your doctor, but this can make a big difference in getting your blood flow circulation going. Take care of your skin. Once you get that initial crust off, moisturizing lotions, creams. I have some links to some favorites online that work really well, but don't let that skin get hard, because the hard skin will make your skin more inflamed and irritated, and that can cause even more swelling. It's a vicious cycle. So moisturize regularly once you get over that initial lymphedema hump. And take care of your whole body. Eat your vegetables, get your blood pressure down, get your strength up as much as possible. Wear good shoes, wear good orthotics. One thing that makes a big difference is a supportive slipper. So Spenco is my favorite, but slippers at home. If you're walking barefoot and you have a lot of foot and ankle swelling, get some supportive slippers like Spenco, Bionic. This makes a huge difference. Or if you wear a shoe at home, put some orthotics into it. I personally, right now, am wearing a good supportive shoe. Brooks are one of my favorite. So I always wear a good supportive shoe inside the house with orthotics. What this does is a shoe and an orthotic can lower how hard your muscles have to work. And if your muscles are working less hard, then you're swelling less. This is probably the easiest thing you can do. Getting good slippers at home, getting good orthotics inside your shoes, or wearing shoes at home can do even better, but it's a little bit more annoying to put on a good supportive shoe and slipper. If you do anything at all, get a good supportive slipper. Some of the links are down below. Some of my favorites, Spenco, Bionic, are great brands. These really, really get your swelling down quickly. There's no real risk to doing this. There's risk to medications, but shoes, orthotics, not a real risk. If that's helping, then get some ankle compression sleeves that are easy and low cost to wear. We're talking like 20 bucks for something that's probably going to help and pretty easy to get on. So slippers, shoes, orthotics, ankle compression devices, those work extremely well. Another thing is go see your podiatrist, because if you're suffering at work, we can write you letters for sit down on your chair, less motion, less 12 hours standing all day long. This really does impact the body in a negative way. Get into good morning routine. So when I wake up in the morning, I rotate my ankles. I get that blood flowing. So everybody's stiff and tight in the morning. So just sit down, rotate your ankles. I like to grab a towel. So first, it's tough for most people to touch your toes. So you can grab a towel and get around your foot. So you could hold that up. That stretches out your hamstring, which is between your butt and your knee, and your calf muscle, which is between your knee and your ankle joint. Those are usually what's tight in most people. If you loosen that up, your feet don't have to work as hard in terms of flattening out and turning out. So another way to do it is put a towel underneath your toes and just lean forward. If something's hurting, don't press as hard into your knees, kind of how I'm doing. That could hurt some people's backs, some people's hips if you're too tight. Start slow, start gentle. Nothing should ever hurt. And then the inside of your thighs. And these stretching boards are available. So this was like 50 bucks. I'm sure it's probably up a little bit with inflation, but start on the lower setting and then gradually as a week goes up, maybe work your way up to the next level. As another week goes up, you can work your way to another level, and you can see your calf muscles, your hamstrings are gradually going to be loosening up. So this is a great way to measure your flexibility. This could lead to less swelling, less muscle pain due to being more flexible. Hey, guess what? We have a phenomenal book. I believe this is the premier book on chronic nerve pain and peripheral neuropathy pain on the planet. I've put years of work seeing tens of thousands of peripheral neuropathy patients, working with some of the best diabetic endocrinologists, the best doctors, the best neurologists, in building out this book. For you, my viewers, we have a discount code available. Get on our mailing list and get that book down here.